Welcome to Representation of Providers and Educators Building Trust in Diabetes. My name is Gwen. I will be your presenter. I am the CNO and founder of the Wellness Loft, LLC. My personal statement, tell me no so I can show you yes. The Wellness Loft was founded in recognition of my ancestors and patients that I've cared for. These persons did not receive health education or learn about lifestyle habits that could have changed their health. The Wellness Loft is composed of Wellness WERKS 8 and the nutritionist and nurse. We develop and facilitate learning strategies that are sustainable and affordable with a clear focus on the individual. This session is for education and entertainment purposes only. We do not diagnose, we do not treat, and we do not prognose. The provider doesn't understand me. Why doesn't the patient comply? Are you familiar with these statements? Have you or a loved one thought these statements? I want you to keep them in mind during this session. The topics that we will discuss are, does representation really matter in diabetes? Why do we need diversity in representation of providers and educators for diabetes? And can I trust my provider? So let's get into it. First, we want to talk about providers. Providers give us the diagnosis of diabetes. But according to the Association of Medical Colleges, there are a little less than 8,000 endocrinologists, physicians that actually practice diabetes, that diagnose and treat patients with diabetes. 256 were Black, 574 Hispanic, only 6 American Indian or Native Alaskan, and a little under 2,000 Asian, and 3,784 were white. Do you feel that you are represented by your provider? Can your provider identify with you? If your provider had a likeness to your ethnicity or culture, would you be able to cope with your diabetes even more? These are things to think about and questions that should be answered. Next, we have educators. Educators are key in persons with diabetes succeeding in their journey. These statistics are fairly recent. We note that 69.7% of diabetes educators are white. We also note 11.1% are Hispanic or Latino. 10.7% are Black or African American. 4.5% are Asian. 2.4% are unknown. And American Indian and Alaskan Native, 1.6%. What do these numbers say to you about representation? Do you as a person feel that you can receive adequate education from a diabetes educator and they not know about your ethnicity or your culture? How does it make you feel? Are you receptive to receiving education? Do they understand what your cultural norms are? Do they understand what your ethnicity is and how that may affect your nutrition and or your activity? These are things that need to be noted, considered, and also answered. Take a look at each of the pictures here. We have a physician with a lady with a glass of water and her head down. But you can see the physician has a question on his face. Next, we have what looks like an educator talking with a client, but the client has his head down. Is he really receiving the information? Below that, we have a patient that feels like he just gave up or looks like he just gave up as the physician is handing him a prescription. In our next picture, we have a lady that looks upset, distraught at what the provider is telling her. Can you identify with any of these situations? I personally can say that I can identify with each of these situations. And I'm sure when you received your diagnosis or you meet with your practitioners currently, you may have had a situation like one of these four. What can we do to make these situations better? When we don't have providers and educators that understand our culture, our ethnicity, our lifestyle, these are the situations that happen, which lead to non-compliance, lack of trust, and not understanding. When actually the goal is for us to lead a healthier life, reduce our blood sugars, and maintain. But as we can see in these four scenarios, we are not meeting the need of the patient at all. The patient is not understanding, the patients are withdrawn, and more than likely, these patients will not comply with what the physician, practitioner, or educator has offered them. Healthy considerations. Please take a look to see if any of these things are important to you. We have ethnicity, emotion, cultural, financial, education, support, occupation, gender, and spiritual. Take a moment to jot these down, and we are going to discuss each one. First, let's go over ethnicity, and we are going to pair cultural with that. Does your provider or educator know your ethnic or cultural background? Should they know this? As an advocate, I'm going to say that they should. Why? Because it broadens the sensitivity to diagnosis, treatment, and education. As an advocate, I can say that it is likely a person will be more advantageous to participate in their treatment plan if their treatment plan meets their needs. Ethnicity and cultural needs are very important, especially when it comes to nutrition and lifestyle. We have to understand the whole person to be able to build trust and proceed with treatment and education. Next, we're going to talk about emotion and support. I want you to think about occurrences that made you feel helpless because you didn't feel the provider, practitioner, or educator were truly supporting you or supporting your emotional need. Let's be honest, diabetes is a big disease. And yes, we can be emotional about diabetes. And there's no fault or any blame towards anyone that has emotions because of diabetes. But how much trust would it take for you to actually understand that emotion and support can help you in your treatment plan and succeed in diabetes? Do you trust your team to support you emotionally? Have you discussed how diabetes actually makes you feel? Does your support team understand how diabetes makes you feel? Do they understand your nutrition? Do they understand that there are literally emotional highs and lows that come along with this disease that you did not ask for? Some key points for your support team. Your support team, including your practitioner, provider, and educator, should be aware of how you are feeling. You should feel free to tell them, today may not be a good day. This is how I'm feeling. This is what's going on. You should be validated with your emotion. When you tell your practitioner or provider, this is how diabetes is making me feel. If a referral is needed, you should have a referral for mental health to help you cope. But emotional support and your support system should validate your feelings, recognize your feelings, and understand what you may be going through to support you adequately, and so you can have a better treatment plan and outcome. Next, we want to go over financial. This is a big thing for diabetes. Why? Because diabetes can be expensive. Not only do we have devices, but we also have to change our habits as far as nutrition and exercise. But we also have our medications, which more than likely is an insulin. Insulins can be expensive. As a patient, it would be advantageous for you to explain to your provider and educator and any other practitioner what your financial system is, what your finances look like, what your insurance situation is, so you can have a treatment plan that is modified to your needs, but will still benefit you. There's no need for a provider to write a prescription for a medication that you cannot afford. But if a provider writes a prescription, knowing what your financial/insurance situation is and offers an assistance program, how more likely are you to receive that prescription that you need to sustain your life? And even for diabetes educators, knowing that nutrition is key in diabetes education, can you refer your patient to places that offer assistance with food, especially whole foods, as we know that they can help in managing diabetes, blood sugar, and hemoglobin A1C. These are considerations that are healthy, not only for the practitioner and the provider and educator, but most definitely for the patient. We want to go over education. This is by far a key factor. Yes, education can stumble your treatment or enable your treatment. Education can build trust or take trust away as well. Providers, practitioners, and educators want to ask their patients, what is your education? What is your understanding? How are you best able to understand what I am saying? For some, it may be written. For some, it may be verbal. For some, it may be tactile. For some, it may be by a video. We want to meet the need of the patient. Patients, be honest with your practitioners. The more they know, the more they should be more than willing to assist you. Again, the goal is to build trust and also have a treatment plan that works for you. Next, we want to go over occupation. Over this last year, occupation is really important, especially in diabetes. Why? Not only as a patient, provider, practitioner, educator, we know that occupation can cause stress. But has your team enabled you with not only the physical tools, but educational tools for you to take to your employer? This is key. Why? Because we don't want diabetes to disable us while we are working. There are rules, there are regulations, there are things that can be provided for you at your place of employment because you are a diabetic. Your physician, diabetes educator can actually equip you with the tools to give to your employer to help you succeed with your diabetes while you are working. Next, we have gender. Gender is important because we know we have friends that are of transgender, lesbian, bisexual, and other identifiers. We want our provider and our educator and other practitioners to understand who we are, how we identify, so they can best treat us. It would not be a good situation to have your provider, practitioner, or educator not understand how you identify. It's key into building trust. It's key into providing a better treatment plan. Patients, be honest with your team about how you identify. Providers, be accepting of what your patients say and be non-judgmental. Everyone has a right. Everyone also deserves best treatment, no matter what their lifestyle or gender is, or how they identify. Last but not least is spiritual. Spiritual is very important. No matter what your faith is, it's your center, if you will. Letting your provider, practitioner, educator know what your faith, your spiritual practice is key. Number one, especially for my Muslim friends that practice Ramadan, we want to have providers, practitioners, and educators that can adequately guide you through Ramadan without having a diabetic emergency. We also know that other faiths and religions may also require certain nutritional practices. So the educator, nutritionist, dietitian, and provider have to be well educated themselves and know what your faith is so they can better help you with your treatment plan so that you can practice your faith or spiritual beliefs and practices without a diabetic emergency or event. So again, ethnicity, cultural, emotion, support, financial, education, occupation, gender, and spiritual. These are just nine things that, if expanded upon, can build trust with provider, practitioner, and educator. If your care team is not asking you about these things, you as a patient most definitely need to ask them or tell them. Building trust is everyone's responsibility. Diversity with our physicians and educators plays a big role. Providers and educators should ask. Patients should share their information with providers and educators. And everyone should understand the goal. The patient's goal is key. The patient's goal is primary. Overall, we want to win at diabetes. We can't win at diabetes when we don't have trust because of lack of representation and lack of understanding. We continue building trust with these three key pieces, these three key people: provider, patient, educator. I noted things that I, not only as an advocate and a nurse, find valuable. And I hope that you can modify this to make it valuable for you and also your treatment plan. For providers, please explain the diagnosis to the patient, explain the medication and the prognosis. Please refer the patient to all other specialties that may assist in the diagnosis. Ask questions to ensure understanding and build trust. I cannot tell you how many people I have talked to that have been diagnosed as a diabetic, given a prescription, no referral, no education, or anything. They more than likely do not comply with what that provider has given them. Trust me. Educator, please assist the patient in learning and making informed decisions that meet their needs and their diagnosis. No patient has the same need, even though they may be diagnosed with the same disease. We have to get out of being textbook correct and actually look at the individual and what their needs are. A diagnosis may be textbook, but a person is human. We are built with different facets and different things. So our responses will not be textbook, but they will belong to that individual. Educators also ask questions to ensure understanding and build trust. And to my patients, please don't fear in being honest with your provider, educator, or anyone else that is a part of your care team. This is about your life, your diagnosis, and any situation that you may go through because of this. Feel free to ask questions. Feel free to question your diagnosis. Feel free to question your treatment. Feel free to question any education that you receive. You have patient rights that enable you, empower you to have a treatment plan with trust and honesty to meet your goal, to meet your need. So please, providers, educators, and patients, practice understanding, giving information, and building trust. It may be a little difficult in the beginning, but I guarantee you it is well worth the effort in the end. And here we are again. Do you remember the statements that we stated at the beginning of the presentation? The provider doesn't understand me. Why doesn't the patient comply? I hope that I have explained why a patient may feel the provider doesn't understand them. And I hope I have explained why a provider may feel a patient doesn't comply. The goal is to communicate and advocate for yourselves, but to also encourage more providers to become diverse in their education of our cultures and ethnicities so they can identify. And we can build trust and have treatment plans that actually work for us and not against us. I want to thank you for joining me. Please stay happy, healthy, and safe.